Welcome, everyone, to the fourth podcast from the UT Austin chapter of PIH. I'm Neha, one of your community building coordinators here, and I just wanted to welcome everyone listening again and tell you that we have a lot more scheduled podcasts coming up. So be sure to check those out on our YouTube.
So let's talk about today's podcast with the housekeeping out of the way. Each week, UT Austin's chapter of Partners in Health will be here with a different group of our community building team to talk about a case study they have researched extensively. And this week, we will be discussing health issues within United States prisons. So let's meet this week's panel.
I'm Roxanne. I'm an informations team member.
And I'm Arianna, and I'm also one of the information team members.
And I'm Faye, one of the information team leads.
Okay, so let's just go ahead and get started. To set the stage, let's begin by discussing the stark reality of the penal system in the United States.
So, the United States has had the highest incarceration rate in the world since 2002, and currently the United States incarcerates 350 individuals per 100,000 residents, which is a pretty stark contrast to the global average of 144 incarcerated individuals per 100,000 residents. And Texas is the seventh highest ranking state in the nation in terms of prison population. Here in Texas, we incarcerate 443 individuals per 100,000.
Presumably, this increased incarceration rate should lead to decreased crime rates. But studies have actually attributed the majority of decreased crime rates to other factors like economic growth, changes in drug markets, strategic policing, and community responses to crime. So, contrary to expectations, the surge in incarceration hasn't resulted in a significantly safer or crime-free society.
So, two significant factors contributing to these ballooning incarceration rates are a lot of court cases that led to the deinstitutionalization of mental health patients, shifting them from inpatient to outpatient care. And as inpatient populations dropped, there was not adequate funding for outpatient treatment, and that left many released individuals without proper care, housing, or social support. And as a result, many of these untreated individuals became homeless and were prone to being arrested for small crimes like substance abuse, petty theft, or disruptive behavior.
Shockingly, a 2009 study found that 14.5% of men and a staggering 31% of women in jail suffered from serious mental illness. In comparison, the National Survey on Drug Use and Health reported that only 3 to 4% of adults in the general population suffered from mental illness. The discrepancies between the academically studied rates of health issues among the incarcerated population versus the health issue rates in the general population will be a recurring topic throughout this podcast.
Now let's delve into the second significant contributor to the soaring incarceration rates, which is known as the infamous War on Drugs, which was initiated in the early 1980s. This aggressive campaign unleashed a torrent of harsh and lengthy sentences for the possession, even if it was just a minute amount of illegal drugs.
Brace yourself for the staggering reality. From 1980 to 2016, the number of individuals incarcerated for drug offenses skyrocketed from nearly 41,000 to over 450,000, marking an alarming tenfold increase. What's more, the aftermath of this punitive approach has been haunting, with a notable lack of treatment and follow-up for drug use and abuse during and after incarceration. This negligence is not just a statistic. It's associated with a vicious cycle of increased recidivism, the tendency of a convicted criminal to reoffend, and a higher rate of death due to overdose.
The racial disparities in drug-related arrests and convictions are blatantly obvious. Despite negligible differences in reported drug use between Black and white populations, Black individuals find themselves disproportionately targeted, more likely to be arrested for drug possession or use. In 2015, the percentage of non-Hispanic, Black, or African American individuals in federal prison for drug offenses was nearly twice that of their white counterparts.
Now let's take a closer look at the myriad of health issues inmates face inside correctional facilities.
In addition to the issue of overcrowding, prisoners also have to face significantly higher rates of disease compared to the general population, and unfortunately, the very institutions entrusted with their care often fall short, especially for the medically underserved.
Infectious diseases are more prevalent in incarcerated populations than in the general population by a drastic amount. In 2021, prisoners were 3 times more likely to have HIV or AIDS, and according to a 2013 survey, incarcerated women had the most risk for HIV infection. Even now, there's no reliable way to confirm these statistics, as access to screening and evidence-based treatment for HIV is not consistently available in many prisons.
The unreliability of disease statistics translates to our understanding of viral hepatitis infections as well, as a 2009 systematic review revealed. They estimated that hepatitis B is about 3 to 38 times more prevalent in incarcerated populations than the general population, and the rate of hepatitis C infection among prisoners was about 10 times higher than that of the general population, affecting around 30% of all people infected with hepatitis C in the entire United States.
The health issues prisoners face are not limited to physical diseases. They extend to addictions and mental health issues as well. Over 65% of prisoners meet the DSM-IV criteria for alcohol or other dependence or abuse. Yet the sobering reality is that only 11% of those with a substance use disorder receive the necessary drug treatment while incarcerated.
Yeah, so it sounds like this lack of intervention puts individuals with chronic addictions at a higher risk, not only for withdrawal while in custody, but also for the possibility of overdosing when they are released from prison.
Exactly. So it's imperative that prisoners receive these drug treatments, as utilizing them for substance use disorders not only enhances health outcomes and mitigates the transmission of infectious diseases, but has also demonstrated effectiveness in decreasing mortality rates and lowering the likelihood of reoffending among incarcerated individuals.
Perhaps most shocking is that suicide has been the leading cause of death in local jails for every year from 2000 to 2000, accounting for almost 1/3 of all deaths in local jails during those 14 years.
Exactly. So it's imperative that prisoners receive these drug treatments, as utilizing them for substance use disorders not only enhances health outcomes and mitigates the transmission of infectious diseases, but has also demonstrated effectiveness in decreasing mortality rates and lowering the likelihood of reoffending among incarcerated individuals.
Perhaps most shocking is that suicide has been the leading cause of death in local jails for every year from 2000 to 2004, accounting for almost 1/3 of all deaths in local jails during those 14 years.
Yeah, that is extremely devastating. And I know that the realm of reproductive health is also something that tends to get overlooked within the incarcerated population. Can you guys talk more about this as well?
Yeah, of course. In 2017, 17% of adults in jails and 7% in prisons were women, and a significant chunk of these women were under 45, which means, that's a demographic with unique reproductive health care needs, and of course, women of color are disproportionately represented in the prison population.
Here's a staggering stat for you. At any given time, between 6 and 10% of incarcerated women are pregnant. Wrap your head around that. A study even found that 43% of pregnant women entering jail in Rhode Island had conceived within a year of release from a prior incarceration. Half of them within 90 days.
Now, here's where it gets concerning. In 2004, about 4% of women were pregnant at the start of their incarceration, but only slightly over half received any pregnancy care. And for those entering prison in their first trimester, the number of prenatal care visits seemed linked to infant birth rate. But most state prison health providers aren't using the best practices for pregnant women.
Yeah, that really puts it into perspective. But this also reminds me of the spark of the reproductive justice movement, which revolved around the human right to maintain personal bodily autonomy and decide when and if to have children, and also parent in safe communities. This movement, sparked in 1994 by Black women who aim to tackle the disparities in reproductive health care for women of color, transgender, and gender non-binary individuals. Do you guys know how this impacted the incarcerated population?
Yeah, I know that incarcerated women and detained individuals definitely face a higher risk for reproductive injustice. And despite existing standards from the National Commission for Correctional Health Care, access to comprehensive reproductive health care is really inconsistent. And data on abortions, stillbirths, miscarriages, ectopic pregnancies, or pregnancy-related deaths in prisons aren't routinely collected, literally erasing any evidence that could be used to fight for reproductive justice inside women's prisons. But hopefully that movement will keep expanding to include and help incarcerated individuals.
Yeah, that's pretty upsetting. So now that we've looked at our country's long history of neglecting and even actively harming the incarcerated population, let's zoom in on the state of Texas specifically, globally notorious for the major issues around crime and punishment. With the largest prison population in the country and one of the largest in the world, Texas seems to be a hotbed for gross mistreatment of prisoners. The latest in a long list of controversies and human rights abuses occurred this summer, but it could also be the beginning of an even larger humanitarian crisis inside Texas prisons.
So we all know that Texas is hot and that it's getting hotter. This summer alone, there were 78 days of triple-digit temperatures, and that's expected to be even higher next summer. And we know the risks of that kind of weather, especially to the elderly and the unhoused and other vulnerable groups. And we all know that temperatures are on the climb every summer, and a lot of U.S. cities would be unlivable without AC. Like in Phoenix, Arizona, they predicted enormous death tolls if the power would go out and AC would be inaccessible. But what does that kind of heat feel like when you spend most of your day inside a brick, metal, or concrete structure with poor old ventilation systems and no AC at all? Those are the conditions in 2/3 of Texas prisons.
As the heat rose, families across Texas faced the unthinkable. There's kind of a personal story to share here with Tommy McCullough. Tommy McCullough's family was one of many to experience a tragic loss this summer when Tommy, who was just 35, passed away from sudden, unexplained cardiac arrest while mowing a prison lawn outside in the heat. The Texas Department of Criminal Justice would go on to report similar deaths of young men with no previous cardiac risk factors as drug-related.
Yeah, it's important to point out that this drastic issue has been responsible for at least 13% of deaths in Texas prisons during the warmer months since 2001. In a broad study of almost 3.5 thousand Texas prison deaths between 2001 and 2019, there were 2,083 deaths in prisons with no AC, and 1,381 with it during the warmer months of the year. So that's almost double. A 1-degree increase above 85 degrees is associated with a 0.7 increase in mortality in air-conditioned prisons. In prisons without AC, that number jumps to 15%.
The data points to prisoners being much more vulnerable to lots of health issues, and that can include diabetes, mental health issues, and cardiac issues. Heat-related illnesses can hit all of these populations especially hard. Some diabetes medications can actually prevent people from sweating, meaning that in some prisons, diabetic individuals are actively choosing between their life-saving medication, without which diabetes could kill them, and the extreme risk associated with the medication side effects in the heat.
Individuals with schizophrenia also face this choice, as many antipsychotic drugs increase the risk of heat-related illness. There's growing concerns that as prisoners drop their meds to stay safe in the heat, there will be no one to help them manage their unmedicated symptoms in the already severely understaffed prisons. Certain antidepressants and heart medications interact with heat too, which treat yet more conditions that disproportionately affect prisoners.
So what does heat-related mortality look like in the general non-incarcerated population?
That's a great question. Heat-related health issues are just an area where prisoners are so vulnerable. During periods of extreme temperature, about 0.35% of deaths during that time are attributed to that heat, but that's slightly lower than even the estimate in air-conditioned prisons. maybe due to other risk factors like limited access to water, shade, and poor ventilation of buildings.
So, as temperatures rise due to climate change, and as we know that there is a link between high temperatures and increased risk, not just in prisons, how is access to AC regulated? Is this still exclusively a private sector issue?
So that's a big part of the issue. There are policies in place on temperature regulation in all kinds of institutions, including jails and prisons, but they vary by state. And in Texas, the Commission on Jail Standards requires an internal temperature between 65 and 85 degrees. But when it comes to prisons, and 77% of those are private in Texas, there aren't many regulations. They regulate jails, but not prisons.
Thanks to public outcry, like what's been happening this summer, which we'll get to in a minute, there are some rules that have been imposed in recent years. There are at least some communal air-conditioned areas in all prisons following lobbying to the Texas Department of Criminal Justice. Prisoners can hypothetically request respite in these areas, which are typically chapels, barbershops, and rec areas, or they can request cooling showers as necessary. However, corrections staffing issues persist across the country, and often there is no one available to monitor the respite spaces. So it just isn't granted. On top of that, there is no protection for prisoners deemed to pose safety risk or require tighter security. If corrections officers decide a prisoner is too dangerous to be in a respite area, the respite request is simply denied.
This summer, as we all probably know, was one of the hottest ever recorded. The spotlight was on conditions in Texas prisons and on the desperate need for some kind of regulation. One incarcerated man in an article for The Guardian wrote about the conditions in his prison 90 miles north of Austin. The temperatures inside have cracked 130 degrees. It's so hot that electronics like iPads, which are sometimes issued to prisoners, malfunction. And there are a few areas conditioned inside his prison, vestibules and staff areas, but as mentioned before, oftentimes prisoners aren't given respite in those areas.
So, how did the public react to these death counts that rose from June to July this summer? I would probably imagine that a lot of people were flustered about it, right?
Yeah, definitely. As these death counts were rising, more and more people spoke up, especially the loved ones of incarcerated individuals and former prisoners who know what it feels like to be cooked alive inside these prisons, and they would gather outside of government buildings to protest.
That's true, but despite protests, communication and outcry from families, and an investigative report by the Texas Tribune finding that 41 prisoners and counting died from what appeared to be heat-related causes this summer, TDCJ acknowledges no heat-related deaths.
Yeah, what's really disturbing to me is that the Texas Department of Criminal Justice actually hasn't reported a single heat-related death since 2012. Which coincidentally is when large numbers of wrongful death and civil rights lawsuits started rolling in from bereaved families who had lost loved ones. Many in their 20s and 30s to seemingly health-related deaths.
This summer, at least 4 prisoners under 35 died of heart-related issues in Texas, most likely related to extreme heat. But in prisons, most heat-related deaths are misclassified and reported later on, as prisons have 30 days following a death to classify and report it. Additionally, dishonesty shows in the mounting reports of non-fatal heat illnesses in prison staff versus in prisoners. This summer, for example, 35 cases of heat-related illnesses were reported in staff, but only 14 were reported in prisoners.
So, what's happening in response to protests? And in the House, what can our government do?
So in May, Greg Abbott killed a House proposal to invest $500 million in air conditioning prisons, which is a pretty straightforward step that would have most likely proved life-saving to thousands for years and years to come. And this summer, the families of prisoners demanded that Greg Abbott call a special legislative session to address heat in prisons and what could be done. But that didn't happen, as most of this summer time was swallowed up by property tax debates.
Some progress, although not enough, has been made. This year, after the proposed budget was killed, the state Senate allocated $85 million to cooling 11,000 more beds, in addition to the roughly 42,000 beds that already have air conditioning. This leaves more than 100,000 prisoners across Texas with no air conditioning for the foreseeable future. Texas has the money to cool all of its prisons, but instead, the state opts for the budget-friendly rather than the humane and life-saving option.
Something I've noticed is that a lot of politicians don't support legislation that outlines these clear steps that we could take to reduce prisoner mortality and increase quality of life, basically just because they fear that they won't be reelected. And in general, across parties, Texas voters support rehabilitation for nonviolent offenders, but they also strongly support a reduction in prison budgets. And on the one hand, reducing the incarcerated population is incredibly important, and in the long run, it's probably money saving. But you all bring up a really pressuring point that we shouldn't be disregarding the lives of the presently incarcerated. And 87% of voters felt that prison spending needed to be closely monitored, and ultimately, politicians worry that a $1 billion bill won't look good to their constituencies when the next election season rolls around.
As we respond to climate change in Texas and across the country and prepare for things to get worse in the years ahead, we need to be prepared to protect our incarcerated population. In the face of this looming threat, the answer might be $1 billion spent on air conditioning, but it might also be non-carceral solutions, decriminalization, and moving human beings out of prison and back into community. Even with air conditioning, a metal, concrete, or brick building is nowhere to spend a Texas summer or life.
Abolition and prisoners' rights is a movement that is gaining more traction by the day. And to justly stand up for health equity in this country, we also need to stand up for one of our most vulnerable populations, one whose health is so often disregarded as an unnecessary expenditure. This is a health issue, a human rights issue, and a climate issue all rolled into one.
Yeah, but we can really help mediate this and push for change. Please keep calling your reps, attending conferences, emailing, and letting them know how you feel about legislation that supports air conditioning in prisons and supports basic rights for the prison population. This is essential to show where their constituency stands. Advocacy now, before an even hotter summer rolls around, is essential. More than that, we need to work towards changing attitudes in Texas and around the country. But this can only be done through your voice and your frustrations being heard by your representatives. Thank you again for listening, and we hope to see you next time on our PIH podcast.